started. Closed captioning is available. You can click on the closed captioning button and get those subtitles if you want them. We also have Spanish interpretation today. I see Cali is here. Hi, Cali. We'll get that interpretation started here in a second. Carlos.
Thank you. Thank you. I appreciate it.
Yeah, Carlos, you want to give instructions here?
Of course. Buenas tardes. Va a haber interpretación en español disponible. Lo
Gracias.
que van a tener que hacer es, una vez que prendan el servicio de interpretación, va a aparecer un globo en la parte de abajo de la pantalla. Le dan clic o aprietan ahí y van a poder escoger el lenguaje, ya sea English para inglés, Spanish para español. Y ahí
Gracias.
van a estar en el canal y yo voy a estar con ustedes.
Muy bien. Gracias. Ya que aparece.
Right,
Okay, you'll see the interpretation here now after I click start. So all members are asked to choose a channel, either the English or the Spanish channel off of the interpretation below. And we welcome members of the public or other folks who aren't formally on the partnership but wanted to join us today. Thank you for being here. We're not going to have a formal public comment period, but you're welcome to chime in on the chat and or send an email to publichealth.policy@state.or.us. And oh, I'm sorry. Thank you, Connie.
You're welcome.
All right. So nice to see you all today. I think you might have seen in the email that we have not yet secured a facilitator for your ongoing meeting. So I will be your guide today. So let me know if I'm going too slow, too fast. Do you want more time, less time? We've got a lot to get through. And it's going to be a really full meeting. Heather, can you go down to the next slide for me? All right. So I thought usually we've done like breakout rooms, but it's been, a couple months since you all were together, and we are welcoming Veronica back after a bit of a family leave. So I thought it would be helpful for us just to like speak out into this space this afternoon for a round of introductions. So if you could share your name, your pronouns, if you can put your pronouns in your Zoom name, that's really appreciated too. And then this is just an opportunity to provide any updates for you or for your agency, your community, anything you're particularly excited about that you want to share, or anything that you think might be relevant to the partnership and the work of Healthier Together Oregon. And I'm just going to call you out based on what I see on my screen, if that's okay. So I'm going to start with Stan. Stan, you want to introduce yourself and share a little bit about what's happening in your world? Are you with us, Stan? There you go.
I just figured I had to push my unmute button. So yes, I'm here. I'm Stan Baker, and he, his, him, and I'm a member at large representing the faith communities, and great to be here.
Thanks, Stan. All right, Connie, you're next.
Oh, darn. Okay. I'm Connie Dillinger, and I don't have pronouns. And I represent so many right now. I'm just going to say I work with All Care. I'm also going to be on a CAC with a new 501c3 that's called Humble Beginnings, and I'm really excited about that. I'll be giving you more information because I'll be begging for money. Okay, who's next?
Great, Connie. I can't wait to hear about that.
Oh, it's very exciting for me.
That's great. All right, Rachel.
Hello, everyone. I'm Rachelschutz, and I'm with the Family Justice Center of Washington County, and I represent both youth and families that are in violent homes or experiencing abuse. And I am in Washington County. I think I said that, but any relevant updates? I don't think so. Yeah, not at this time.
Great. Thanks, Rachel. Jess, you're next.
Yahweh, our greetings, everybody. My name is Jess. I go by he, him, his. I am the president of Oregon Marshallese Community Association. And the updates. Just a lot of COVID vaccine events that we're putting together. And currently there's a lot of folks who have COVID-19. So we're working on wraparound services as well. Other than that, it's good to be here, and I'm honored and humbled as well. Thank you, guys.
Thanks, Jess, for all your work to support community during this time. Still, months later, you're still at it. Thank you. Amy, you're next.
Got it. Okay. I'm Amy Thurin. I'm the director of the Healthcare Coalition of Southern Oregon. And the main things that we're continuing to work on are facilitating some perinatal task force. So we're focused on families right as they're becoming families. And our focus right now for these 4 months is ACEs and resilience. And then we move into postpartum care and then teen reproductive health this year. Do I pass it or shall
We can pass it to Talk. How about that?
Thanks, Christy. Talk Sonola Gillespie, she, her, sow pronouns, and I'm the Director of Community Health at Health Share of Oregon. And for those who don't know, we are a CCO, Coordinated Care Organization. We are responsible for supporting close to 400,000 Medicaid members who live in the Tri-County area. We have a lot of updates, so I'm not even going to go into it that relate to this group. But yeah, we'll just leave it at that.
Yeah, you got one thing, one exciting
Just one.
thing to share?
I mean, we're looking at figuring out ways to use Medicaid dollars to support housing related services. How about that? That's big.
Yes.
Right?
Yeah. Takes a lot of creativity.
And a lot of permission asking.
Yep.
To not just OHA, but even, CMS, right? Center for Medicare and Medicaid.
Yeah.
Some innovative stuff, but right now we're just in the beginning stages of thinking about which groups to really prioritize first, right? So not that we're not going to work with everybody, but we've got to figure out which groups that we can look at this with. And right now we've narrowed down to our foster youth and those individuals coming out of corrections. And I don't even know why I'm blanking on the other group. Transitions from behavioral health, right?
Great. Thanks, Talk.
Thank you.
All right. How's it going, Ian? You're up.
Hey everyone, my name's Ian Winbrock. I use he, him, his pronouns. I'm here in Eugene, Oregon in Lane County, representing a community-based organization perspective. I'm the chair of the Whitaker Community Council. We're a 501c3 nonprofit that's been serving Eugene's poorest community for almost 50 years now. One update is that we were chosen as the only Oregon nonprofit from the CDC Foundation to do art from underserved communities that supports vaccine confidence. So we're going to do a series of 5 intersection murals and 5 crosswalk murals that talk about the intersection of vaccine confidence and public health. And we're also going to have artists in residence at a freestanding mural wall. It's kind of like a legal graffiti wall where a community member is going to be hosting mural workshops that showcase vaccine confidence. So excited to share that with the group when the project advances.
That sounds amazing. Can't wait to see pictures, Ian. Yeah, really cool. All right, Cali.
Hola.
Hola.
Hi, I'll be speaking in Spanish since we got a translator, right? I'm Cali Morales from Uvalde and Helmerston. I work directly with the communities, helping with medical insurance, with prevention, helping them, so that we can get out of this situation. As I was listening to what Ian was saying, in reality, we could do something like that with graffiti, that says something like, hey, you want to finish this pandemic? Get vaccinated. So yeah, we're doing some advocacy because, the youth, I think they are a little resistant to it. And I think that would be a good way to get them involved. And so they know how important they are to us. I'm very happy to be here with y'all, listening to everyone. I really like what Talk said. Sorry, I'm unable to pronounce the last name, but it is great that we're seeing that we're all just so interested. And knowing that, hey, we have you folks here in the organizations, because, it's not just folks in the government, but actually people that are willing to make changes, that think farther to help out the community, and that the people know and feel that we are there to serve them. And that's what we're here for, to help them the way they should be helped. Thank you so much.
Great. Thank you so much, Callie. So glad you're here. Carlos, everything working okay on the interpretation side?
It is for me. I hope it is for y'all.
Okay. Yeah, that was great. Just let me know if you need anything. Okay, Timor, you are next.
Yes, hello everyone. This is Timor Holov with Slavic Community Center of Northwest. My pronouns are he, his, him. Slavic Community Center is a CBO, also 501c3 nonprofit that works with Slavic Eastern European communities and also FSU community members. FSU, those are the people from former Soviet republics. And exciting news. Well, the caseload is going down a little bit. We are working with the community members to provide wraparound support and education. And it's definitely a big relief to see that we are starting to get less self-referred cases, which means that, hopefully the peak has been reached and now we're kind of going down. And hopefully that trend is going to continue. And, hopefully soon we'll get to do something else besides, all the COVID related stuff.
Won't that be nice?
It would be.
Feeling good vibes about summer 2022.
Yes.
Thanks, Timur. All right, Veronica.
Hello, everyone. Veronica Leonard. I use she, her, ella pronouns. I am the Director of Health and Wellness at Latino Network. As Christy mentioned, just recently returned from maternity leave. So my exciting update is that I now have a 8-month-old. Her name is Isa, and she's great. She's keeps me very busy in addition to my 2-year-old. So if I ever look really tired, that is why. And at the agency, there's just been so much growth while I've been gone. Really exciting. I have like 5 new folks on my team that I hadn't met before, and we're still hiring, both to respond to COVID and, as some of you have mentioned, to also think beyond COVID and improve the health outcomes of our community. Thank you.
Great. Welcome back, Mom. We're so excited to have you here. I'd love to see babies at any time. They might pass through the screen. Okay, I think we just have Jennifer. Jennifer, there you are. Hi.
Hey there. Sorry I'm late. I'm Jennifer Little, she, her pronouns. I'm the Director of Klamath County Public Health. And relevant updates, I mean, we're just drowning in COVID, but trying to do other really important public health work too. And I think maybe an exciting update is we just met with the Klamath Evangelical Association to try to bring them into our community health assessment work and then subsequently our CHIP work. And so it was a really great meeting, and we're excited for new partnerships.
Great. Can't wait to hear about that, Jennifer. Thanks for being here in the midst of everything else that's going on in the local public health authority world. Okay, I think that's it. Let's get going. Heather, can you move to the next slide for me? Okay, agenda. We got quite a bit to go through today. We've got some report outs from the guidance committee and the policy committee and the funding and finance committee. There's been a lot of exciting conversations that have taken place in those groups since you all kind of chartered them into your work at your December meeting. So looking forward to hearing what happened there and getting your thoughts and reactions to that work. We will take a little break around 2. Then we've got a brief update from colleagues Liz Garst and Meredith Knowles from OHA's Public Health Division about a SPINE grant, that's State Partnerships Improving Nutrition and Equity. So we'll hear about that. We'll spend a little bit of time talking about the HTO annual report. There's a draft of that report in your meeting packet. I hope you had a little bit of time to take a look at that because I would love your feedback. And then the last half an hour, we're going to be welcoming PhD Director Rachel Banks for some continued conversation and exciting news. So with that, I think the next slide is a report out from the guidance committee. And Stan, you're gonna. You're up.
Thank you, Christy. Guidance committee, we held a retreat on January 27th that was focused. And I'm reporting to you this afternoon on behalf of the entire guidance committee, Connie Dillinger, Susan Blaine, Alicia Overstreet. She's not able to be here right now, but a shout out to her. She's a wife, mom, and she just somehow managed to complete her master's degree in forensic psychology. So when you see her, wow, congratulations. We're really proud of Alicia. Sorry to say it, Esther Kim, with her other leadership responsibilities, has had to leave the guidance committee, but we want to thank her for her service as a whole. The partnership facilitation contract, we're really glad that Christy can step in so ably today. But the first round, there were no qualified applicants that we were able to choose. And so a second round of the process began and will be completed, in fact, today. We hope to have several qualified applicants, and the guidance committee will then be able to review them. And our hopes is that we'll be able to offer a contract and have it accepted before our next meeting. Hesitate to contact Christy or any of us. A point that did come up is about the public participation in our meetings. It's stated in our charter that we value the openness of our meetings to the public. However, concerns have been expressed about all the meetings being open. So for now, at least in the near future, we are continuing to have the meetings that people want to be part of it, but we're going to pause on sending out the public meeting notices for those that want to attend. But we're going to kind of hold back on proactively communicating about our meetings until we can get additional feedback from you. We'll be sending out a survey shortly to collect your feelings and ideas about this, as well as the partnership in general. As far as on the public part of the meetings, any particular comments or thoughts on that right now before we move on?
Stan, this is Jennifer. What were some of the concerns around not having them public? Was it like interruptions or just be curious?
I think where they kind of focused in on was that not every member of our partnership has been comfortable perhaps in commenting or talking or taking part of our discussions. And the concern was that there might be those that are not comfortable with sharing everything in a completely public setting. There's also the idea that perhaps it might be best that perhaps some of our meetings could be in confidence to meet on these issues. One reason we're sending out a survey to everyone to try to get a sense of what the partnership as a whole would like to do.
Thank you.
You're welcome. The work plan, the other purpose of our meeting was to discuss and review the work plan. So on the next slide, you'll see we start talking about the work plan. Let's see here. Can you move it to the next slide there, Christy, for me?
Heather's actually running the slides. Heather, can you advance, please?
Well,
it's also in
consider
your
the work
meeting.
plan.
It's also in your meeting packet if folks want to pull it
Okay.
up and look at it.
There it
It's
is.
a
There
little
it is.
small
Great.
to read on the screen, so.
We established 3 areas of work that we went forward on. The first one is to establish an engaged and active partnership. And part of the survey is coming to you is going to speak to this of what can be done so that more people will be engaged in the process and what we're doing, actively engaged. Every one of you, thank you for what you're doing. But we would like to have greater engagement on a whole knowledge, value and use of the HTO by health equity partners around the state. Now, in this one, it comes down to, we looked at the need for a communications committee. One of the challenges of establishing another committee right now is just the ability of the OHA to staff and to support another committee. But yet, for instance, with both the policy committee and the finance committee, there are needs to communicate their discussions and decisions that they're making. And there's a need for the guidance committee also to be able to effectively communicate. How can we take the step forward at this point in time? One thing talks about we need a complete partner mapping among the partnership. We really don't know everyone's interests. We don't know what your expertise is or what part you would like to be involved in. And so you'll be receiving an email in the near future asking exactly those kind of questions. What can you do? How could you be of help to the partnership as a whole? One idea that we had as far as perhaps we need to have another member on the guidance board. One thought was if there be a member of the partnership that has expertise in marketing or communication that might be willing to step up to be part of the guidance committee, then that person could be there to help guide and direct how best we can communicate, and could be a first step towards forming an active guidance, an active communication committee. We do need to have a person, no matter what, though, on the guidance committee to join us. And I'm wondering, is anyone that's on here today that might committee? It's not a tremendous time commitment on your part. I find this last time, of course, we had the retreat, which does not happen every month at all. But typically, maybe 4 or 5 hours a month is what I'm finding is being required on the guidance committee. We have a regular scheduled committee meeting for about an hour and a half once a month, and then there's emails back and forth and so forth. But I'm wondering, is there anyone here today that would be interested in volunteering to become part of the partnership Is there anyone would like to do that?
Hey, Stan, can I interject for a minute?
Yes, ma'am, you can.
Okay. Okay, here it is, guys. We need some more fellas on the guidance committee, because we have singled Stan out. So we would really, really like to have another male, and I hope I'm not saying that discriminatory, but it would be nice for Stan to have a little buddy to kick it with, because us girls, we're already doing. So come on, you guys, come on. It's not that hard. It's kind of fun, to be honest. We have fun doing these meetings. So if we could get a good volunteer, please.
We do have fun in our guidance committee meetings. I can promise you, if you become part of the guidance committee, you're going to have a great time. Great people, great fun. If think about this, and you can respond in the chat room, or let Christy know, or anyone on the guidance committee, or if there's someone you would like to nominate, just let us know. We would, if possible, we'd like to have another member before our next meeting comes up. So anyway, if you'd like to be part, we'd love to have you. The I'm sorry, go ahead, Connie.
No, I'm just looking at the chat. So you go ahead. I'm gonna turn my mic off.
Timor and Ian. Hey. Timor and Ian. Great. Anyone of you guys would be great. I'm telling you, anyone on it all. So I'm not sure, can we take and make sure that Tim or Ian might be willing to serve, or what's the best way forward here, you think?
Yeah, I mean, we could, oh, sorry, Timor.
I was just gonna say, I just joined the financial committee, so I don't know. I don't think I can commit any more time. I'm just gonna be too overloaded. I won't be able to handle it, unfortunately.
And I'm in graduate school, and if my partner Emma hears that I've taken on one more commitment, I'm afraid that I'll be sleeping in my backyard. So I'm super humbled, and I know that whoever steps into that empty seat's going to do a great job. But yeah, I'm pretty stretched thin right now.
And you know, I don't know, Rachel, you nominated Timor and Ian. Would you have any interest in being part of the guidance committee?
I might just be interested in kicking it with you, Stan.
It'd be great to have you, Rachel. We would love to have you as part of the guidance committee, if you might be willing to serve.
When are they? First Wednesday from 9 to 10:30. I'll take a look at my schedule and I will let you guys know. But
thank you.
And also, Rachel, if that time would not work for have a standing meeting, just let us know, and we can find a time that would work for everyone. You'd be very welcome to be part of the committee.
I feel the love. Thank you.
And thank you. Let's see. The other piece we did was to establish the partnership, as talked about, establish the partnership as an accountability partner for advancement and prioritize strategies. Now, under the activity relationship with related councils like participation in mutual meetings, agenda items, public comment, letters of agreement and understanding, joint policy recommendations, information sharing. We suspect that there may be much of this already taking place, that among you and the groups that you represent, many of these activities may already be taking place, and we just to find a way that we could formalize it to become part of the partnership. And this is going to be part of the email, the surveys you're going to be receiving in the mapping that you already have in place and you're already working with. Please let us know, and because we'd love to work with you and work with them as well. To go through the work plan, just a few things I want to touch on here. And we're hoping to have 2 in-person meetings this year, one in May and one in October. Now, this of course is going to depend on many things. It'll depend on COVID and probably wondering as far as the partnership as a whole concerning having in-person meetings this year. I'd like to get kind of a sense, are you in favor of this? Where should it be located? what are your thoughts? Would there be value in this? If you have some comments or thoughts about in-person meetings this year.
I'm probably one of the most Southern, and I am interested in doing an in-person meeting. And I'm happy to come up your way.
And
I
just
think it would be a great idea.
thank you, Connie and Amy. And just to confirm that these meetings would be fully supported. So for those of you who do have to travel, you know, we'd be paying for your travel, whether that be by plane or by car, for overnight accommodation, for per diem. And those expenses are eligible for people who'd be traveling 70 miles or more to the meeting. And location is yet to be determined. I think we could probably send out like a follow-up survey or something to get a sense of what location might be preferred for folks. And, you know, I think in this work plan, we've actually sketched out 2 in-person meetings, one in May and then one in the fall. So we could certainly, you know, think about moving the location around. So I'm hearing Hawaii. Yes, that sounds amazing.
Thank you, Heather. Thank you, Rachel. But it is more than 70 miles, Christy.
Yeah. No, that's what I'm saying. If you would be Hawaii would be more than 70, and that would be pretty expensive. This would be a funding and finance committee decision.
I'm on that and I approve.
Okay.
Am I hearing that, are we generally in favor of having some in-person meetings, perhaps in May? We could perhaps talk about specifically when in the fall. And it sounds like perhaps in May, we can maybe have it in the Portland area. Anyone thumbs down on this particular idea of an in-person meeting?
Looks like Ian's got a comment or question. He's got a hand raised.
Go for it, Ian.
I know this makes it really hard to do, but I think that we should also have a hybrid component if possible. So those who need to do childcare, are sick, have to stay back home for whatever reason, are still able to participate. And it does make things a lot more difficult from hosting hybrid meetings. I've found that you need to work extra hard to make sure that those who are online don't miss what's happening in the room, and those who are in the room don't miss the rich conversations that are happening virtually. But I think it's really important just in case some folks aren't able to make the in-person meetings. But yeah, I love the idea of being able to see everyone in person and enjoy the dynamics of an in-person meeting. It's been a really long time.
And that's a really good, important point. Christy, would it be possible at the in-person meeting and say in May to where those that could not be there physically could be there virtually?
Mm-hmm. Yep, for sure. I wonder.
There's a question in the chat, Christy, from Cali, and I think it's if it's only for the guidance committee or if it's for the entire partnership.
This would be the entire partnership. Mm-hmm. And Jennifer agrees with having a virtual option as well. So Stan, I'm just looking at the time here and want to make sure we have enough time for the policy and the funding committee to report out. So I would maybe one way to kind of advance the in-person meeting conversation, I could send out I think we did this last year, didn't we? Where we had a survey and I think we asked like thoughts on location and date, and
that'd be great.
There might have been a question there about, you know, would you come in person or hybrid? So we can send something out and start getting some plans together. Fingers crossed.
I'll move on then. Basically, we're going to August, vacation time, recess, enjoy yourself, play with the dogs, go to the beach. To move on into the we have talks about the guidance committee, policy committee, finance committee, and communications committee as far as what their responsibilities are. On the communications committee, as we do the mapping You may have some suggestions also about how to deal with communications, and we're certainly open and would love to have a discussion with you about that. The next several are about the 7 strategies that we put together and have been working with. This work plan is a living document, and it's subject to change and updating and edits on a regular basis. We would like to know if do we have a consensus on this work document, on our plans for the year and what we're doing? And would love to have any questions, and then would like to have a vote, thumbs up, down, sideways, as to if you would approve it as currently drafted. So it's right now by anyone.
We missed a sentence, Stan. I did. I'm sorry. I don't know about everybody else.
Which sentence did you miss, Connie?
Something with regarding voting on something?
Oh,
Thumbs
yeah, on
up,
the
thumbs
work
down?
plan. This is
Okay.
on the work plan. Would like to have any comments on the work plan as far as the way it's laid out for January through December activities, and any comments or suggestions. And then would like to have a vote as a consensus if you accept this.
So first, are there any questions or comments on the document that Stan walked through? Heather, I see you got your hand up. Did you have?
I was going to suggest that we see what rooms are available in Portland that can support a hybrid meeting.
Oh, okay. Yep.
Those calendars and what rooms are available when we choose to send out dates in specific locations within Portland.
Yep. Definitely. Any questions or comments on the work plan before we? Okay, I'm not seeing any. So this is obviously a living document that will evolve as we get going here. But as it is currently laid out in terms of the 3 goal areas for your work together and kind of the high level schedule of how you would use your meeting times, is anyone thumbs sideways or thumbs down? Thumbs sideways meaning, I don't know, I think this, I want to see something changed. Thumbs down meaning no way. You've got a concern. Anyone thumbs sideways or thumbs down? And you can chat it out, shout it out. Okay. Stan, I think everyone is thumbs up.
Okay, well, that's great to hear. Appreciate the opportunity of serving the partnership. Do not ever hesitate to contact any of us on anything at all. We're here to serve, and we are excited about what's happening. We got a great future. So again, thank you very much, and pass it on to the next one here.
Great, thanks, Dan. And just from a logistics perspective, I'll clean this up and finalize and post it on the Basecamp and send you all a link. All right, thank you, Guidance Committee. Moving along, next step, I think, is it policy next? Heather, can you advance the slide for me? You can keep going.
Okay.
You can keep going. I think it's just 2 more. There we go. Yes. All right. Policy committee report out. Amy. Thank you.
Hello. Oh, and you even have the bullets on here already. Okay. Hello, everybody. And I get to report on behalf of the policy committee. We have about 4 main points as our update. OHA has asked us for a series of policy recommendations as they develop legislative concepts for the 2023 session. As a group, we decided or proposed that they look at the 7 strategies that we picked back in December. They'll use that as an organizing framework for combing through the public input that has been collected. Karina Walker, who's presented to us in December, has been attending and will continue to attend to work with us on this. We highlighted that we want to build relationships with policymakers, and so we're working to develop tools and talking points to share about HTO and at the state and local levels. And we talked about putting together some legislative days as well. Did I see that Heather just raised her hand, or is that old?
I think that's an old hand raise, Heather.
Okay. We also have the legislative tracker that we shared out. I think we shared out, Christy, or is that just internal? Yeah.
It was shared in a Friday email, and I can drop a link into the chat here.
That would be awesome. The short session has begun. And a number of HTO related bills have been introduced. So when you look at this tracker, you can go through and see all the specifics. As you comb through, it'd be great if you could note any specific bills that your agency or community is interested in tracking or providing testimony on. We talked about having a coordinated effort to try and show up for some of these bills this year, but decided it'd be too rushed based on our timeline. So we are going to be looking more at a long game of forming relationships and building understanding about what we are and what we're doing, and look to the next session for more impact. And that's kind of it for our updates. We have a small group working on this, so if anybody would like to join us, that would be great. And as you look through that tracker, if you're able to email Christy or any of us, anything that you're working on, we would really appreciate that. And then Ian is part of it. If anybody else is part of the group wants to share, please feel free. Okay.
Any questions or comments for the policy committee? I don't know if partnership members are tracking any bills or testifying for any bills. There's a lot of exciting things that have been introduced that are very well aligned with some of the strategies in this plan.
You can always chat it into the box too.
Cool. One thing that I can share, I don't know if anyone has been following House Bill 4052. This is the bill that was the Racism as a Public Health Crisis bill that was introduced in the last session. And didn't get passed as intended. It got passed as a House concurrent resolution, which is like a nice declaration about something, but it doesn't put any meaningful action or resources behind it. So community has brought this bill back with an ask of funding to establish a pilot of mobile health units. It's also as written, section 2 of this bill would call upon the Oregon Advocacy Commissions to convene affinity groups for communities of color specifically to develop culturally and linguistically responsive health interventions that would address all of the social determinants of health. And so I think this might be an interesting to watch as it relates to Healthier Together Oregon, because I think it might be a way to really leverage the work that you all do at the legislative level in the future. So that might be one to watch. I know it's one that I'm personally tracking and providing some analysis for. And I know that there was a hearing for this bill already, so it's still moving. As you know, this session moves very quickly, and I think it was by today, if something hadn't been scheduled, then the bill, and then it would have died. So. All right. Any other comments or questions for the policy committee? Okay, then let's turn it over to Timor, who's gonna report out from the Funding and Finance Committee, and then we will take a break. Timor.
Yes.
Brand
Hello,
new to the
everyone.
Funding and Finance Committee.
Yes, I'm very new to this. And last week was my first meeting. So bear with me. I'm gonna try keeping it short and sweet. And if I miss anything, please do feel free to just interrupt and let me know if I missed anything. All right, so we met last Friday, and if I'm not mistaken, we meet once a month last Friday. All right, and the committee is in charge of allocating block grant funding and identifying additional resources. So hopefully we'll be looking for some other places where we can secure funding and work with the funding in order to promote the work that we're doing. And our first goal as the finance committee is to help allocate $100,000. Yes, we have $100,000 that needs to be spent by October 1st. And as we know, time just zips by. So we definitely got to work and found some, talked about some ideas, and I will be sharing them. And then at the end, there will be time for questions and additional discussions. So yes, so the first thing that we were in charge of was to identify communication as our priority, and there are 4 options. Option A, use funding to develop strategic communication plan informed by evaluation. Option B is to conduct another round of H2O seed funding, but direct money to CBOs for direct use in the community. Option C was to develop H2O related materials to be used in communities and with policymakers to support the idea from policy committee. Or option D, something else, could entertain other ideas, suggestions from the group. So are there any questions so far or comments?
I wonder if it would be helpful if Liz provided just a quick overview of what the HTO seeds funding was about. I'm not sure how many folks on the partnership might know about that, and that might be helpful.
Yeah, I think it would be helpful because, again, I joined the committee just recently, and I had a lot of questions and things that I didn't know about. So if Liz has an opportunity to share, that would be greatly appreciated. Liz.
Yeah, thanks everyone. So the HTO Seeds project that we did was a social media project where we paid community directly to do some social media posts, and we paid for some videos and for some Facebook posts, but we were able to kind of direct the money to community directly to kind of like have them be able to generate the content themselves. And we talked a little bit about the difference between being able to pay kind of community-based organizations directly versus working through a contractor, which is always more expensive and tends to tends to drain the funding faster. So that's just kind of one option. And we were able to kind of, it was basically a mini grant of 5,000 or less. And with a mechanism, the way the state works with paying and contracting is really complex, but we were able to really simplify it to just a purchase order where we were able to kind of pay for that content and be able to generate some really cool content. We're still waiting from our communications folks to be able to distribute it, which is the other kind of challenge of, having the content ready. And waiting for OHA Facebook because we don't have any social media channels, but the seeds funding could be a different project. It wouldn't necessarily have to be social media, because that's what we talked a lot about in that committee, was that sometimes social media is one way, but there's also kind of other ways to reach community that aren't always reached by the social media audience. So yeah, so Christy dropped the link to the playlist, the YouTube playlist, and that has all the partnership meetings, but it also has the HTO Seeds videos there that you can see that are all on the YouTube playlist.
Great overview. And the discussion was much bigger. Liz did a great job explaining everything and how the money floats and where it goes. So I don't know if I can recommend anybody reaching out to Liz maybe, and if they have additional questions, but are there any questions so far?
I have a question. I have one question. With regards to number B, this is for Tamir and for Amy. How do you keep track of the spending when you direct money to the CBOs? How do you track the money? How is it tracked?
Great questions. I don't think I'll be able to answer that questions because I'm fairly new, but maybe was it in a form of a grant? And then
that was my first, that too. If it's in the form of a grant, how are you tracking the monies?
Yeah.
And maybe Amy can answer that. I don't know.
Well, for the Seeds project, we were able to, because it, like I said, was below a certain threshold, and we were looking for content from specific communities, we were able to pay them without a grant process.
Oh, okay.
So it just went through a purchase order process, but that's because we kept it in that, I mean, we've done mini grants before. We call them mini grants because they're just not a lot of money, right? They're 5,000 or less, but there is a mechanism that we have to pay. We can pay organizations. We can't pay individuals, but we can pay organizations $5,000 or less without having to go through the whole grant process, which is its own thing. You have to have insurance, and there's all these things that come with the government grants, but we were able to kind of do that a little bit differently and found this way that we could kind of get some of this content and distribute the money among different organizations. And that was tracked through the grant spending. So we have, we basically have our budget, and it was tracked through the budget, which is what the finance committee will monitor, is that budget.
Oh, okay. Thank you.
I have a quick question. In terms of the communications or sending out, oh my gosh, these materials. So option B and C are essentially means that we would be sending out materials related to the HTO to the communities, correct?
I think the difference here is who would be developing the materials and doing the communicating.
Okay.
So for option B, we would pay money to CBO partners to communicate about HTO in the way that works best for them and for their community. Like they would be determining a lot of what that is. Option C is more at an OHA level with the partnership of you all to develop materials that are a little bit more centralized, I guess, and could be used in community through your networks. But the audience, I think, is a little bit different.
Okay.
The audience for option C would be a little bit more of those policymakers.
Okay. So then my next question, I guess, is because our option B says that we're going to have the option is to have another round of the seeds funding. Do we have any data on, I guess, how efficient or successful the first round was in terms of reaching people within the community? Because I guess I know that one of the concerns is that, are we reaching the people that or the people who actually need to hear about these opportunities, especially as they relate to the HTO. I don't know why I keep doing that. So I guess I'm just wondering, do we have any data on how successful that was? Or is that even being tracked? Because I'm interested in, and I guess I'm going towards option A, because I'm kind of interested in developing a strategic communications plan. Because what I'm hearing on that, it means that we're kind of going back to, I guess, looking at what has worked, what hasn't worked, and who have we reached, who do we need to reach, or whom do we need to reach, in terms of communicating what HTO does, or what the whole goal behind it is. So I guess I'm just wondering if we have any data on if any prior communications has, how successful it was, or if that is even being tracked.
Yeah, we don't at the moment, because the content has not even been published yet. So that's the issue, is that we and why we talked about doing something that's not social media related, because we're still trying to get that content published. And we've been trying for about 4 months now, but we don't have our own social media channels. So that's our challenge, is that we've been trying to get it at the OHA level, but OHA has been exclusively focused on COVID. So trying to get OHA to do things that are, at the OHA Facebook level that are not necessarily related to COVID has not been an easy thing, even though some of the stories are related to COVID, which is why we collected some specifically from some of the great organizations who've been doing the COVID work. But I think that that's part of it, is it doesn't necessarily have to be a social media project. If it's a seeds project, it can just be like distributed, and it can be also distributed by the community themselves, which would be a different model than what we used the last time, because we were trying to create this. And this was not, by the way, this was not made, the HTO seeds project was not made with HTO funding. It was actually made with leftover modernization funding that needed to be spent within a short period of time. So this was a project that we just kind of pulled together because there were some excess funds in the modernization budget for the biennium, and that's what funded this. So it wasn't kind of out of our block grant. It was something separate that we had some additional resources to do. But yeah, but there are definitely ways to, once that content is being able to get out and be distributed, then we can track that. But we're still in the process of trying to distribute the content.
Okay, so the content that would be distributed through option B would be different from the content that was distributed in the first round of the seeds?
Exactly. So the first round of the seeds was just our project focused on social media. So gathering stories within social media through videos and posts and pictures, right? So that doesn't have to be the model for what this could be. This could still be a seeds project, but it could be what came up was like radio announcements, there might be, radio is often a good way to reach certain populations, and of course rural populations. So there's a specific niche that's not reached by social media that's better reached by radio. So it could be that, that the Seeds project funds radio projects as well. So yeah, so it's not that we're saying that if it's seeds, it has to be a social media project, that it would just be something that, like before, was generated by the community. So you're essentially paying the community directly to generate that content.
Okay. So then I guess my follow-up question to that would be, what is the difference then between option B and C, and then going through the developing a strategic communications plan? What would that entail? If option B already kind of has the framework in place, or am I hearing that wrong? I'm trying to wrap my head around these different options so that I can.
No, I understand it. I was kind of new to the conversation myself, so I kind of came in to provide some context, but I'm not quite sure, honestly, about like option A, where that, kind of where that came from. I don't know, Christy, if you can kind of speak to that. That might have, did that come out, or Amy, I don't know if that came out of a previous meeting or discussion that you all had.
Yeah, that was some conversation that happened in the Funding and Finance Committee.
I think part of the, one of my questions, I wanted to have like an overall plan so that we could divvy it up and not have it just be different requests were coming in, we were spending it down. But I think one of my original thoughts was if we were doing a communication plan, that one of the tangible outcomes would be option C. So we would do the plan and then we would have this thing to be able to give out. So I would really like to do something like that where it's we know what we're working with, and then what's left over, we're able to carve out maybe doing seed funding with the rest or something. So that's just one thought.
Yeah, because I know that because in the policy committee and guidance committee, we've been talking about like communications being a really big piece of the work that we do. So that's why I was wondering about developing that strategic communication plan, because I'm really interested in that. I just wanted to know how, or kind of figure out what the difference between the different options are. So I appreciate it.
Alrighty, I think we're over our time. It's 2:05. So last thing that I wanted to add, if there are any questions, you can reach out to any of us. But one of the things that we also talked about was to potentially fund some in-person meetings. So if there are any ideas for those, and I think we talked about the meeting in May, and we touched a little bit on that during the previous conversation with one of the members. So, and also support for capacity building and learning opportunities for partnership members, conferences, conventions, I guess. But yes, feel free to reach out to us. Again, I'm very new, so if I missed anything, I do apologize. And yeah, that's all from our end. Thank you.
Thank you, Timor. Yeah, lots of conversation in the chat, which is great. It sounds like there is support for a hybrid approach. And so maybe a next step for the Funding and Finance Committee is to revisit these options and get a little bit more specific about the numbers and kind of better understanding how much could buy what, and come back to this group with a little bit more specifics and details around some of these options. Does that sound okay to folks? I think we would, by March, I think we would want to make a decision, just given that we need to get this money spent by September. And Cali, I saw your comment here about considering the needs of carceral populations and your concerns there. I'm not sure how you want to handle that. Your point there. Did you want to say anything more about that, Cali?
Sí, considero que ahorita.
Yes. You know, I'm thinking, because we have an area right now that someone's getting back to folks. There's a lot of folks who are leaving prison who don't have a home. They don't have health insurance, of course. And, you know, they can be prey to COVID, you know, because they don't have all the supports around them. So, you know, I'm here to ask for the assistance so that we can think or create something, because instead of making prisons bigger, I think that we could take certain measures of prevention because most folks who are going into the prisons, they are young folks for misdemeanors, and they just come out real bad, and that keeps on affecting our communities. So aside from the pandemic, I think that we are having this other huge issue to deal with.
Yeah, thanks, Cali. Yes, that is definitely an area of concern for OHA. And I'm wondering if we can maybe table that conversation, because I think it's really relevant to your March meeting. I'm hoping to bring in subject matter experts from OHA's behavioral health system to talk a little bit more about the behavioral health investments and some of the work that's going on there as it relates to the ballot measure 110 group. And that's the bill or the ballot that decriminalized substances. So there's a lot of money that's going to support recovery and treatment instead of carceral and incarceration. I think the other thing that we could maybe bring to you all, if you're interested, is some of this is addressed in the waiver that OHA is putting together, the waiver application. That's our every 5 years we get to ask CMS, the Center for Medicaid and Medicare Services, to do something different about how we administer Medicaid funding. And one big piece of that waiver application is specific to the needs of people who are incarcerated and transitioning out. And I've got a link here that I can, with more information that I'll pop into the chat about that population too. But I will certainly make a note to behavioral health colleagues next month to make sure that they talk about the needs of this community. Thank you for bringing that up. All right, group, we're going to take a 10-minute. Oh, Cali, did you want to say something?
Es eso que me gustaría ser parte de esto.
That's just it.
Okay.
I'd like to be involved with that because, out in Umatilla, out in Mora, it's part of my work, and I want to be working in this, as we're doing our campaigns with the COVID vaccines and all. But, with all this, that it's just incrementing with more stress at homes. There's issues with the schools closing down. We're seeing criminal rates go up with our youth. So yes, I absolutely want to be involved with this.
Great. Thank you, Cali. Okay, let's take a break and come back at 2:21. That's a 10-minute break. I'll see you then. Great. It is 2:21. Welcome back. If you could turn on your camera or give me a little something to let me know you're out there and ready to go. All right. I see thumbs up. I see laughing faces. Thank you, Jess. Thank you, Ian. Thank you, everybody. Okay. So it's 2:20. We're going to be joined here at 2:30 with Rachel. So I'm just gonna propose that we skip the HTU annual report to that, and that's feedback that you can provide via email if you want, and or if you do want time to talk about it, we could see about maybe bringing it to Mark's meeting or the guidance committee. So let me know what you think about that. But we'll just plan to skip that agenda item today, which is fine. And Heather, you want to mute yourself?
Heather, can you advance the slides?
Yeah, and I'm going to turn it over to Liz Garst and Meredith Knowles from OHA's Public Health Division to talk to us a little bit about a new grant that we just received to support the food security related strategies that you all prioritized.
Thanks, everybody. So I wanted to let you know, so this came out of the work that we started with Oregon Community Food Systems Network. So our H2O in an action event in September focused on housing and food, and Oregon Community Food Systems Network reached out to us and wanted to meet about the work that we're doing under Healthier Together Oregon. So we had a meeting with them in November, and they expressed the need to be supported in a couple ways. They want to do some statewide convenings around food security and increasing food security and building a resilient food system. And then they're also interested in some local work. So how do we take, because they're basically the main food policy council for Oregon. I put their link into the chat, and they have 57 different nonprofits that are part of their coalition. They're a really great network. They've been working for several years and doing some amazing work. So we wanted to see how we could support them. So shortly after our meeting with them in November, we had this grant opportunity come up from the National Association of Chronic Disease Directors. And they have this new program that they're calling SPINE, which is State Partnerships Improving Nutrition and Equity. So we were able to quickly, within a couple weeks, pull a grant application together and submit it that was focused on the initial conversation we had with Oregon Community Food Systems Network and around their needs. So the activities in the grant are all around convenings and supporting them and to be able to do some convenings. So the grant is for $144,000, and then we have to take 20% out of all federal grants for cost allocation. And then what we have left is at least $112,000 that's going to go out to our community partners. So the way that we structured the grant application is that half of that would go to Oregon Community Food Systems Network for that statewide convening. And then 25% of it would go to a local community-based organization that is a part of OCFSN or works with OCFSN. And then the other 25% is going to be designated as preference is going to either one of the tribes or to tribal serving organization. And that is really going to be up to the tribes whether or not, because they actually want to be able to convene some folks around food security and around food first and some of the work that they're doing. But we didn't have enough time to be able to build them into the process because we had a very short period of time. So the way that we solved for that is we made preference to the tribes, and then it's up to them whether or not they want to take us up on this grant money. And if it doesn't end up going to one of the tribes, then it'll go to another local CBO. So basically it's going to be 3 activities that are going to be under the grant. And like I said, so it'll support some statewide work. And then it'll also be able to support some local work as well. And then hopefully some of the tribal work within that's already happening in the food first and in the tribal food sovereignty area. So that's kind of the intention of the grant. It is for the calendar year 2022. And this is really going to be able to bring some resources to this new relationship that we're building with Oregon Community Food Systems Network. And it will also help us in the implementation of the 2 strategies that you all prioritized. So it's up to the partners whether or not they want to do in-person or virtual convenings. They have to do a minimum of 1 convening, but they may, if they choose to do virtual, they may have the budget to do more than 1. So it's really, we're leaving it really so that it's community designed. So it's community designed, it's community led, it's community implemented. For the most part, it's just the pass-through grant where the way that we wrote it was broad enough so that the partners themselves can decide how to how best to spend the funds in terms of helping their own network with training and technical assistance. So there's a lot of flexibility in the funding, and the convenings, like I said, they can support folks, through whatever ways that they need to help people to be able to participate. And we wanted to be able to bring some resources to this work because we know that they're already doing the great work, but they express some specific needs. So we've since met with them, and they're going to have a leadership retreat where they're going to decide what their priorities are and how they want to spend how OCFS and what to spend the money. And then we will go from there. But that's kind of the general overview of how this grant came to be, from our initial meeting with them in November to receiving the grant in January. It was a very quick turnaround in time frame, but we're really excited to be able to bring some resources to this new work. And we're really excited that we're not being directive about the funding, and we're really letting the organizations decide how best they want to use it. So Meredith, do you want to talk a little bit about the next slide?
Yes, thanks, Liz. Can we advance the slide to the next one? Thank you so much. As Liz mentioned, she gave a great overview of how this grant came to be and what the next calendar, or what this calendar year is going to look like. So over the next now 11 months, we would like to use the RE-AIM framework. This RE-AIM framework is a way to evaluate if a program or an intervention really effectively translates research and intent into practice. So we'd like to use this with the partnership to really monitor how this grant moves forward over the next year. And what we're planning to do is develop a set of questions under the framework to use for evaluation, and that we'll be able to report on and respond to at an interval that makes sense, and it will likely be at 6 and 12 months for this 1-year grant. And so with a couple of minutes that we have left before Rachel joins, we really wanted to bring to this partnership the question of if the partnership is interested in having an oversight an evaluation role with this grant, and if so, would that make the most sense to be with the full partnership or perhaps one of the subcommittees?
And I wanted to just quickly add too that this isn't a formal thing that's required under the grant. This is really for OHA, because this is a new thing. This is a new investment that we were able to get. It's kind of a new direction of being able to do this upstream work. So we were just interested in the partnership kind of helping us understand, like, this is the intent behind what we want to do with this, and did we achieve the intent at the end of the year?
Thanks, Liz and Meredith. I'm wondering if there are any questions or comments from partnership members before we address kind of this evaluation question. Okay, not hearing any questions. I see Stan has a comment about the finance committee overseeing the evaluation. Stan, do you want to say anything more about that?
Yeah, this is a really interesting area in this what's being done here, and it certainly ties directly in with our priorities as the partnership. And this might be one that the finance committee could be involved with in evaluating, and also use the knowledge gained.
Thanks, Stan. You cut out a little bit on the audio, but appreciate your support and offering of the finance committee. Are there any other thoughts or suggestions? Liz and Meredith, when would you need to know Like, would this work start now or in a couple months or?
This work will start in the next couple months, so we have time.
Okay, great.
I guess I have one, I guess, clarifying question. So the ask of the partnership is to be in this evaluation role, I guess, conducting the, based on the re-aim framework, correct?
Yes. We would develop like the questions for it, but really the ask, yes, is for the partnership to be involved in helping just hold us as staff accountable to what the intent of HTO is through this grant, and just make sure that we're staying on track and we're serving the communities that we intended to serve, and we're having the impact that we intended to have, really guided by the priorities that you all set for us as well.
Okay. So would the partnership, actually, let me rephrase it. Would OHA be the body to kind of send out this, the survey, or is it a partnership that sends it out and then evaluates it?
I think that we would develop the questions for you all just to kind of help us kind of see if we're matching that intent with the outcome, really. So it would be more just sending out the set of questions at the 6 month and the year mark for you all to kind of help us gauge if we're going in the direction that we want to go, especially since this is kind of a new framework in terms of just passing through the funds and having it be, you know, completely community directed, and just having us do that informal evaluation if we kind of hit the mark of where we want to be with this grant.
Okay.
And you guys can feel free to contact us with any follow-up too. You can email Christy or myself or Meredith or all three of us if you have any follow-up questions. We realize this is just kind of a short introduction to this, but we wanted to just bring it to you all so that you're aware.
Great. Thank you, Liz. Thank you, Meredith. I'll certainly add this to the agenda for the guidance committee and the funding and finance committee. And we'll touch base about how to loop the partnership in. Sound good?
Good.
Okay. All right. Thank you. Thank you. All right. We've got about 25 minutes left, and I'm really excited to introduce you all to the Public Health Division Director, Rachel Banks, who is with us today. To share a little, hey Rachel, to share a little bit about Healthier Together Oregon in the context of lots of things, in the context of COVID recovery, in context of OHA's 2030 goal to eliminate health inequities, and to share a little bit about OHA's vision for what HTO could become here with your direction. So Rachel, thank you so much for joining us for a little discussion and dialogue.
Yeah, thank you. Good afternoon, everybody. So Rachel Banks, I use she, her, and hers. And just for a visual description, I'm a Black woman with my hair pulled back, sitting in a blue room with a gray jacket on today. It's great to be here, and just want to start with gratitude and appreciations for the time and your partnership. I love that. Sorry, I just can't. I just every single time it's just so so catchy. But in all seriousness, just your thoughts and efforts and expertise in helping us to move forward a community-centered plan that's really going to take all of us. I'll start maybe just with some ground setting, if that's helpful for folks around COVID recovery and where we are organizationally. So as we, OHA was setting up to respond to COVID, obviously it's clearly a public health response and a public health emergency, and knew that we needed to really surge. And so the mechanism that happened was through something called COVID Recovery and Response Unit, which was a unit that was set up that can move very quickly and nimbly, and has folks from the Public Health Division and other parts of Oregon Health Authority, and was meant to be a partnership between Oregon Health Authority and Oregon Department of Human Services. So we call that the CREW, in case you've heard that, the COVID Recovery and Response Unit. And in December, we moved the CREW into the Public Health Division as intact, and know that we want to take the remainder of this year to really be thinking about how we analyze the lessons learned, how we plan for COVID recovery and resilience phases, and how we maintain the work that needs to happen, really think about how we can carry forward some of the innovations and blend shorter and longer term public health strategies. So I think that's really, to me, where I get very excited about Healthier Together Oregon as it relates to COVID. The second R in CREW, that recovery, that resilience, because it lays out a map of what our community needs in its entirety to really be healthy. And you know, I will say, in all honesty, I think many of us are so wanting to get to the recovery out of the response part of COVID, and have iterated or stood up a conversation about what does recovery look like, and everyone wants to get there. And then there's been some fits and starts just as it relates to various different surges. As we are hitting the peak and for Omicron cases and preparing to hit some peaks in terms of hospitalizations, we have been really all in an Omicron response, just to be, like I said, totally transparent about that. So there's still opportunity to have the conversation. I think it would be great to queue up maybe this group in the next meeting or whatnot, to bring some CREW folks or other OHA leadership as well, to have a conversation about how these things align, because I think that there's a ton of opportunity, and we hear a ton of overlap in terms of the community listening sessions that have been happening, the culturally specific efforts that have been happening, and on the ones that I've been a part of in a variety of different communities. You know, talking about the long term, like folks don't want us to forget about communities in the long term, and also don't want us to move too fast and saying, okay, well, this is just over now, we're moving to recovery. So I think it's a really thoughtful conversation that's needed. And what does that recovery look like? And that Healthier Together Oregon provides us a really great, I think, framework to do that, and a starting place to say, you know, does it still make sense? Where should we prioritize? Are there different starting places or prioritizations just based on COVID and what we've learned? The other thing that Christy asked me to talk a little bit too, and then I'm happy to stop talking and take questions or reflections, is in terms of Oregon Health Authority, where is Healthier Together Oregon in the role and work and possibilities with OHA's leadership goals. And I think it's, you know, once again, very well aligned. Oregon Health Authority, our strategic goal is to eliminate health inequities by 2030. We know then that the paradigm for success has to change. It's a community paradigm. And that then our work as an anti-racist organization, which is one of the tools that we've been using and training up. In fact, that's why I'm late, so I apologize. But did make a commitment not to miss any of the anti-racism sessions that we're doing as part of a Oregon Health Authority leadership team. That's one of the commitments we made as we're continuing to go through that. But to then line up what are our performance measures and what are the goals and strategies. And so in the course of our work, we have talked about Healthier Together Oregon really being a great umbrella, if you will, if that term resonates, and just how many of the strategies, it's you know, folks could see themselves in that. as it's behavioral health strategies, and there are access to care strategies, and of course all of the anti-racism, anti-colonialism work, and the dismantling systemic racism strategies, as well as housing and the social determinants of health. And for us doing that really through that community perspective and paradigm. So there was a lot of agreement that totally makes sense. And we, OHA leadership, just like I was saying before with the COVID thing, I think, I don't want to speak for everyone, but we're eager to get to those longer term conversations about our role. And there are lots of different efforts happening, I think, where people are really applying an anti-racism lens and anti-racist tools and policies to our strategies. So I'm going to pause there, and Christy or others, if there are other things you directly want me to speak to, otherwise I'm happy to hear what folks' thoughts are.
Hi, Rachel, it's Connie. I was going to ask about with OHA, we're speaking about reducing systemic racism in the healthcare field. How is it going with hiring doctors and therapists of color? How is that going for the state of Oregon?
Yeah, thank you for that. I think that that's a key piece as we're looking at addressing our goals of achieving health equity. And that's, and as you said, Connie, been an important piece of understanding, and we need to have providers that understand, that are reflective of community. I think there's a number of different efforts happening, and I surely don't want to claim that I understand all of the efforts, because I have some amazing colleagues that are doing great work. In our ballot measure 110 efforts, and really having a community driven process, looking at wanting to make sure that we have providers that represent a variety of different communities of color, peers, those with lived experience, those with disabilities as part of our behavioral health workforce is work that's ongoing, and then the corresponding grant process and whatnot. We certainly see that work too in our Office of Equity and Inclusion, that works with community health workers and healthcare interpreters, to make sure that workforce is included. Right now, we've supplemented our hospital and health system workforce because of Omicron and Delta before that, with a number of healthcare providers that are coming into the state. And one of the mechanisms that we realized we needed to add was our expectations and commitments towards equity as part of an orientation process, just acknowledging that those providers that are coming in, this includes National Guard, as well as other providers that are coming in through contracts, are coming from a lot of different places and perhaps have worked in a lot of different agencies and are going to different health systems. And that we wanted to say really right up front, here's our expectation and our goals. So that's some other efforts that have happened as well. And then I think through more in the community-based work and peers, as we're working with community-based organizations throughout COVID, and wanting to make sure that things that maybe have been medicalized or services that primarily had occurred in health settings, that whereby that makes sense to keep doing that, like federally qualified health centers. But we heard a lot of that there was a lot of barriers in that for communities, and that the more community-based, field-based that we were able to get with services, let's just say vaccines or testing, that we're doing that so people can receive those services in communities that they're in, neighborhoods that they're familiar with, by and with folks that they trust, and in partnership with community-based organizations.
Thank you.
Yeah, absolutely. If there's other folks who know of additional things or want to chime in with something that you or your agency is doing, I'd love to hear about it as well.
Yeah, this is Alicia. I have I guess a couple questions, but so I'm wondering about are we having any conversations about how are we going to address the very specialized needs of Afghan refugees. In particular, I mean, looking at Oregon's kind of mental health and behavioral health accessibility and you know, our rating overall, we're not very high up on the totem pole at all. I am very, very concerned that we're not good. I mean, we're not really meeting the needs of our kids and youth here. I'm very concerned that these Afghan refugees are coming over with some very high trauma, and their needs are not going to be able to be met. Are there any conversations about that? Like, what are we doing to meet their needs as well as, I guess, Oregonians' needs, which, so yeah, I guess that's one of my biggest questions, or one of my biggest concerns, because we have a whole kind of military history, and one of our concerns is the very people who have helped our service members and military members. You know, they're coming over here seeking refuge, and they're not going to be able to be supported. So what are the, you know, what and if, you know, if we're having these discussions, what are the discussions and how are we going to address their needs?
Yeah, thank you, Alicia. I appreciate that question, and all the ways in which you asked it, with the context surrounding it as well. I know that we have the public health role into that conversation at times. Sometimes I think, you know, is maybe narrower than is advantageous, and then we need to pull together a more comprehensive strategy across the agency. Part of this, I'd love to be able to get some more information and get back to, but I can share what I understand at this point is that, you know, we definitely have a role, particularly as it relates to communicable disease and ensuring folks have the vaccinations and the appropriate screenings. And that happens with a variety of different communities, but with particular focus depending on what's happening across the world. And I know that there's been specific conversation with refugees from Afghanistan, particularly in some of our sections. So I'd love to get back and see how that conversation has progressed. I know that over the course of the past couple of years, we've then added what are the community conversations and how to include community-based organizations as well, and not just come in from you know, that perspective. I think as your question around trauma is such a great one, and it's one that I think about too, just as specifically with specific groups and collectively as we've all undergone this collective trauma, and you know, and the corresponding things that we're seeing happening because of that, whether it's disconnection from community or other public health measures that we see. So I think that, you know, more to come on the trauma conversation, but it's so needed. And I think especially as, you know, OHA talks about health inequities and what are the things that drive good health, optimal health, and what are some of those barriers. I think understanding the gradations of trauma that folks are experiencing and the needed supports is going to be so key. And I think, you know, back to Healthier Together Oregon is one of the things that I really appreciate about the plan is that it includes that holistic health piece of it, and that understanding that, you know, we need to be having a broader conversation that really is across not only just OHA, but across different divisions in OHA and larger in the community as well. Once again, if there are other folks from my team or other places that have a more updated understanding or some more to add, please do. Otherwise, Christy, I'd love to note this as a follow-up and have Colette and team get you kind of an update and who they're working with.
Yeah, that'd be great, Rachel. I can follow up with Colette. And I also just want to note that I will put a pin in this for your March meeting as well, when we'll be joined by folks from the Health Systems Division of OHA to talk about the behavioral health strategies. And I'm hoping that they'll have some information to share around this particular community as well. I think we've maybe got one more time for one more question before we wrap up today. And I see Ian raising his hand.
Thank you so much for joining us and asking or answering our questions. I should have worn my formal cardigan if I had read the agenda a little bit more and knew that you were coming. I wanted to talk to you a little bit and kind of get your impressions about how the idea that recovery and response are mutually exclusive. I feel, at least in the context of our community, they are not. And so one example of that is that at the beginning of the pandemic, when we didn't know a lot about transmission or what the vectors of transmission were, like being in a room with someone unmasked versus having COVID on a surface. For us, there's a lot of human feces and a lot of needles in our community. So something that could be part of response and recovery would be the building of a public restroom. And so we've scoped that, and we're in conversations. I'm in Eugene, Oregon, by the way, in Lane County, around having a Portland Loo style restroom, and it's going to be between $500,000 and $1 million. And it's not a very attractive project for philanthropy in the state because it's been done before, even in the context in which it would be done. It could really have some multifaceted uses and really improve public health and help us recover, because it could have loads of kind of positive externalities to community development and business development. And then on top of that too, we received some funding from the CDC Foundation. I don't know if you're here at the beginning of the meeting when we talked about how we're using public art installations as a mechanism to talk about vaccine confidence from underrepresented artists. And we're doing those in intersections where there's been high instances of calls for service, because we know that public art can beautify areas and create kind of pro-social engagement. And so I think that there's probably some curious ways, at least in our neck of the woods, that we've kind of combined response and recovery. So I just wanted to get some of your thoughts on that. And then also, I just know I'm much more familiar with like our own county and city context for the ARPA funding. So I'm just wondering too, are you all beholden to the same kind of calendar spended by end of calendar year 2024, or are you looking to wholesale new funding streams for the recovery work?
Yeah, thank you. Great questions and thoughts. I love the way you talked about the examples of where recovery and response are the same thing. I think we could also think about it in terms of prevention and intervention, right? In that, in the largest context, us, and art and culture and healing, being a part of both the pursuit of wellness and the prevention of poorer health outcomes. I think they go together really, really well. For me, sometimes whereby folks can understand public health through COVID more so than they would have understand public or community health, just when we're talking about population health or some of those words that weren't often necessarily in the public vernacular in everyday terms, then I'll try to use it to talk about how we get to longer term outcomes, and some of those intervention or some of those strategies that could be seen as COVID recovery really are response to a variety of other public health things. So I could overplay that at times, I think, just personally and talking about it, but I absolutely think that, the understanding that people have around a collective, how us acting collectively helps individuals and helps health, I think can be helpful from the COVID example. I really love the examples that you used that offer multiple benefits, as well as like valuing humanity and reducing stigma and investing in folks who already have a lot to deal with and are often left behind. So the example of the public restroom, there's a variety of health pieces there. I think there's the dignity part of it. There's harm reduction as it relates to syringe exchange. There's just art as a means of connecting community, providing visibility to the healers and artists in our community. I mean, there's just so much there. that I do think those two things are mutually exclusive. I also think that there's a discipline and emergency preparedness and response that really has a model that is usually shorter than what we've been responding to in COVID, that has, you know, here's your response, here's your demobilization, here's your recovery. I'm not an expert in it, but it has those phases. And I think sometimes in the conversations that I've seen, we're toggling them a little bit and learning with a pandemic that's had a really long time frame. How do we use those frameworks of recovery, but also acknowledge this is the work that we need to be doing as a community for folks to be healthy. Oh, and then the ARPA funding. This is where I really don't want to get myself in trouble with the funding conversation. We have a variety of different funding streams with different timelines. That's part of the challenge in us figuring out kind of what are our strategies. There's some grant funding. There's a variety of different ones. So we're in the midst of right now trying to figure out what our funding scenario is, what we think we're going to need to continue the work in COVID response and recovery, as well as some of our ongoing funding streams like public health modernization, which has been an investment from the legislature for a number of years to braid those things all together so that we can have the best community response, and ideally in a way that's easier for folks to access those fundings, and that we provide funding in that and from a variety of those different mechanisms, whether it's to tribes, local public health authorities, community-based organizations, and all of those. So kind of a messy funding picture there, not a clear answer, but more to come as we're trying to figure out.
Thank you so much.
Yeah, thank you. Oh, and by the way, like where, in terms of what to wear on the agenda, wear whatever.
If you were here, I would give you a hard candy from my 90-year-old sweater pocket. So yeah, thank you so much.
And that would be like the best part of the day right there.
Totally.
Oh, well, that is a great ending to the meeting. Rachel, thank you so much for making time for us today. I think we would welcome you back anytime to share your insights and your wisdom and hear the thoughts and dreams of the partnership members. And we're at 3 o'clock. We did not get to everything today, folks, so please read that Friday email very carefully. I'll be putting in some important information into that email. And yeah, we'll see you in March, if not sooner. Thank you so much, everybody. Thank you, Rachel. Have a great afternoon, everyone.
Thank you.
Bye. Bye-bye.
Bye.